OldGuyTalks.com is all about being a better man. Join me on this kick-ass journey. Exclusive stuff for members only in the Old Guy Cave. Opt in now. This is information only. Consult with an appropriate professional before starting any program. Do not be stupid. You are responsible for your own shit. The old guy is a capitalist and not a socialist weasel. He will be promoting stuff here and may be compensated. You can rest assured the old guy only promotes stuff he uses. You may have different results.
This is Oris, the old guy from www.oldguytalks.com, here tonight with Dr. Adam Splaver. I got to get that name spelled and pronounced properly. That's right. But before I do, I need to satisfy Sue, the lawyer IP babe, with this disclaimer, folks. That's right. This disclaimer I got to read. This is information only. Consult with an appropriate professional before starting any program. Do not be stupid. That's right. Do not be stupid. You are responsible for your own shit. The old guy is a capitalist and not a socialist weasel. He will be promoting stuff here and may be compensated. And you can rest assured that the old guy only promotes stuff he uses. That's right. Only stuff he uses. And as they say in the commercials, you may have different results. That's right. You may have different results. So okay, now we got that bit of housekeeping. Tonight, I'm pleased to have Dr. Adam Splaver. And so a couple of things. There's a long list of things that are important for you to know about him, and we can spend the whole program talking about him, but I'm going to try synopsize them. He's the co-founder of Nano Health Associates, and he's a cardiologist and focusing on molecular levels of cardiovascular disease, age management medicine, Reiki. Is that pronounced Reiki meditation?
Reiki.
Okay. He's a certified trainer at Wake Up Warrior, which is where I met him. That's a men's group that we belong to. He's edited books on cardiology, numerous academic appointments, multiple medical board certifications, multiple publications, multiple clinical research projects. And folks, the man is busy. I'm going to post his CV in the program notes on my site at the end. The man is busy. I have no idea how he manages to get this all in. It's actually a testament to his work ethic that he actually can do all this stuff in one lifetime, folks, in one lifetime, because it seems like he's got multiple personalities, all of them very functional, going on at the same time. So, Adam, let's talk about this. How did you end up on this journey of functional medicine? How did this all start for you?
Well, it's really funny. When I was getting older, in my older 30s, I started realizing that things weren't working out the way they should have been. I was gaining weight. I was getting tired. My libido was going down. My ability to concentrate was an issue. And so I figured, you know what, I better do something about this. And after doing some research, I got myself involved with one of these big age management medicine programs, who agreed not only to treat me as a patient, but also train me as a physician, which was a phenomenal experience in itself, because it gave me a basis. It gave me a background of how to treat the maturing body from a metabolic perspective, a hormonal perspective, nutritional and fitness perspective, which was awesome. And when I went through that and saw the changes that I was able to achieve by utilizing their methods, I thought, hey, this is phenomenal. This is incredible. But from my perspective, it felt very cursory, almost superficial. And I decided that I need to go dig deep. And that's how I got myself involved with the American Academy for Anti-Aging and Regenerative Medicine, otherwise known as A4M, the letter A, the number 4, and M.com. And they have a number of different certification programs. And so I took courses in advanced endocrinology, as well as cardiovascular disease, metabolic disorders, hormonal imbalances, things like that. And by incorporating a lot of these practices, a lot of these theories, ideas into my practice, I was able to at least help my patients become better versions of themselves. Because I got tired. I got really tired of just pushing the pills. So, okay, you have blood pressure problems, here's a pill. You have cholesterol problems, here's a pill. And you're tired, here's another pill. And by the time you're done, people were walking around with lists of pills that were longer than their CV for that matter, which is a huge problem. A huge problem. Why should someone be a walking pharmacy when I don't think God intended on that? So after using all this knowledge and incorporating into my practice, I was able to get a number of my patients not only from being a pre-diabetic or diabetic into non-diabetic, or making them into less of a diabetic, but also reversing blood pressure problems, cholesterol issues, heart disease, hormonal issues. Because if you think about it, cardiovascular disease, cardiology is more than just the little box that sits right in your chest. It actually, believe it or not, it deals with the whole metabolic system. Everything affects everything else. You change your metabolism. You're going to change the trajectory of atherosclerosis. You change your ability to process sugars and diabetes. You're also going to change. You're going to diminish or make worse your atherosclerosis. So that's why I took more of a holistic approach towards medicine, or more of a holistic approach towards cardiovascular disease, because it all really fits together. It all really affects each other. And by not doing so, I'd not be doing my job as a cardiologist. Sure. And that's how I ended up where I am.
Yeah. So Adam, you mentioned something. I'm gonna ask you a personal question.
Sure.
How old are you?
I am 46 years old.
Oh man! Oh shit! You are a punk. You're a punk.
I'm 46 years old.
I'm 65. So,
yeah.
So my question to you is: you started mentioning these changes that you were feeling. Well, when did you start feeling these changes? Well, how old were you?
My mid-30s. I was getting more sluggish. I was getting more overweight. I was getting more grumpy. My libido was going down. I wasn't able to concentrate as much, and I just wasn't happy. I wasn't me. And so when I saw all these changes and realized that this is not right, this isn't right, I need to get to the bottom of this. That's how I ended up going down that route.
Yeah, one of the people that I've had on my show here in the past, named Jay Campbell, wrote a great book on testosterone replacement therapy, and actually he's got another book that he's just putting out. It's with basically 400 references on the whole topic. It's pretty amazing book. But he was a guy who played college basketball, and he was suffering from low testosterone at age 30.
Yeah,
at age 30. It can happen at any time.
It's not unheard of. But the issue is that everyone thinks that they can just give testosterone and fix it. It's a lot more complicated than that.
Exactly.
It's a hell of a lot more complicated than that, because it could be a number of factors that are causing it. One could be that you have too much estrogen being produced that's being converted from testosterone. You have to approach that very differently than someone who's just not producing enough testosterone, or someone who may have even like a pituitary tumor that may be preventing them from even getting that mechanism up and running. So I caution all my patients, or any patient who wants to go on this type of therapy, they go to someone who knows what they're doing, because there's so many different nuances and different ways that you need to approach this, depending on what the actual cause of the problem is.
Sure. So for our audience, and some of them, what's the difference between what's called functional medicine, I guess I'm used to refer to as anti-aging medicine, and traditional disease-based medical?
Well, it's a very good question. For many years, medicine has been very reactionary. It's been, we're waiting for disease to happen and then let's treat it, which isn't really a great idea. I mean, think about it. You take your car to the mechanic to change the oil. You're proactive about it. You change the filters. You top off the fluids. What are we doing with your health? You're waiting till you get sick before you do anything about it? You're not supposed to do that. So that's how that process at least played out in my brain. Regular medicine should not be waiting, being reactionary, rather being proactive, being predictive, being on top of things, so that way you can maybe even change not only the trajectory of disease, but also make people feel a hell of a lot better. And so that's really the difference between traditional medicine and functional medicine, where you're really trying to get ahead of the game, getting ahead of the curve, and trying to make a big difference in that regard by preventing disease. I've given this example a number of times, for example, with testosterone. Traditional medicine says that testosterone levels should be between 250 and 1,000. Unfortunately, that traditional medicine numbers, 250 to 1,000, is the normal for any man who's aged 18 to 99. So if you're 99 years old, your normal testosterone level will be about 250. If you're 25 years old, your testosterone level will be 1,000. So my question for you is, what do you want to be? Do you want to be a normal 99-year-old guy, or do you want to be a normal like 30, 25-year-old guy? And that's really where it boils down to. Traditional medicine will just let you slide, let you go into that abyss until you go beneath 250, and then consider possibly replacing. Whereas functional medicine is more of, all right, listen, your total testosterone should be probably 800 to 1,000. If you're dipping below that and you're having symptoms, maybe we should consider treating it. And again, there are different ways one can treat it, and only by going to someone who's adept in that field can and should actually be treating it.
So, what outside of testosterone, and because that's the one thing that people focus in a lot, and then also you mentioned the converters, the estradiol converters, and so how do you deal with that? How do you deal with the converter?
Okay, so in many people who have low testosterone, it's not because they're not producing it. It's because they are converting their testosterone into estradiol. There is an enzyme in your system that lives mainly in fat cells called aromatase. That enzyme is responsible for taking testosterone and repackaging it into estrogen, estradiol. Well, estrogen is not supposed to be high in guys. If it is, it increases your risk for cardiovascular disease, stroke, peripheral vascular disease, clots, maybe even certain types of cancers. So, if you're having,
I know, and Adam, let's not forget man boobs.
And yes, man boobs. You do not want to have man boobs.
You don't want to have man boobs.
It's a huge problem, and that's the other issue when you're going to someone who doesn't know what they're doing with hormone replacement therapy, and you have an overactive enzyme, this aromatase enzyme. If you give them testosterone, you're basically fueling your body's conversion to estradiol, estrogen, and you're increasing man boobs, and you're increasing all those other risks that we discussed.
Sure.
So that's just one approach in terms of how do you treat a low testosterone if your estradiol levels are high. If your testosterone levels are low because your testes are not producing it, then you can either replace it with regular testosterone. You can give it in a cream, a gel. You can give an injection, or if your testes still have the ability to produce testosterone, then what you can do is you can give them either an injection of HCG. You probably heard of the HCG diet.
Right, yeah.
Well, that works very nicely because what HCG did is it mimicked the alpha subunit, a certain particle that your pituitary produces to tell your testes, hey, it's time to make more testosterone. So you can take that, or you can take also, there's a pill form Clomid or clomiphene citrate, which also does a similar job. Also increases your fertility. So many guys who go on this type of therapy also become more fertile. So again, there are very different ways you can approach it, depending on the cause. There are also some guys who end up, and I've picked this up on a number of guys, who have a pituitary tumor, a tumor of their master gland that sends a signal out to the testes that by doing so it destroys that hormone LH, and therefore the testes don't produce testosterone. In that situation, some of these guys need to have surgery, neurosurgery, have the tumor taken out. Some of these guys need medication therapy. Other guys just need some surveillance to have to watch it. So again, if your testosterone's low, it's not, let's just replace it. We need to start asking questions. We need to figure out why it's low. And as you mentioned earlier, this functional medicine doesn't only apply to testosterone. It applies to everything across the board, like your sugars. For example, diabetes. Diabetes is a metabolic disease that gums up the works. It causes blocked arteries. It causes microvascular disease. It causes kidney problems, stroke, heart attack. Well, the goal in diabetes is really to get your sugars down as low as possible, at least in the functional medicine world. And we look at something called the hemoglobin A1C, which is a marker of how well your sugars have been controlled over the past 3 months. So your hemoglobin A1C really, really, really should be less than 5.7. That's it within the functional medicine world. Within the traditional medicine world, they'll let you slide higher. Unfortunately, the more you let people slide, the more likely they are to turn into a diabetic, and the more likely that they will not be able to reverse it. I use the analogy with my patients. For example, people who have high sugar levels in their bloodstream, whether because of diet or just environmental factors, it's tantamount. Do you ever watch I Love Lucy?
Yeah.
Okay, so do you remember the I Love Lucy episode where Ethel and Lucy are in the chocolate factory and had to wrap up those little chocolates?
Yeah.
Well, so in the beginning, the conveyor belt went by very slowly, and they were able to keep up with the chocolates. Well, As they showed that they were proficient in doing that, the foreman came out and she said, "Speed it up!" And of course, the conveyor belt went by faster, and then of course they failed. The chocolates went on the floor, they went into their hat, they went in the mouth, down the shirt. Well, it's the same thing with your pancreas. What happens is that over time, as your sugar levels keep going higher and higher and higher and higher, just like with any worker, your pancreas can't keep up with that. Your pancreas can't keep up with that high sugar load. So what eventually happens is your pancreas fails. It gives up. Part of your pancreas will die, and it'll be almost impossible to reverse it if you let it go on too long. So that's where, at least in the functional medicine world, we take a little bit more of a proactive stance, looking at your sugars. Not only looking at your sugars, but also looking at your fasting insulin levels. Because people can have normal sugars. You get your blood test back, and you get your sodium, your potassium, your chloride, all your electrolytes. But of course, they throw in a glucose. Well, people think that, oh, my glucose is normal, so everything's fine. No, that's only part of the story. You also have to look at what your fasting insulin level is. Insulin is a hormone that's produced by your pancreas that's responsible for taking whatever sugar it sees and repackaging it actually as fat, storing it as fat in your body. So that way it clears it out of the bloodstream. Well, if your fasting insulin is really, really, really high, that means your pancreas is working on overdrive just to keep your sugars at a normal level. Mm-hmm. So you have to look at more than just the cursory blood levels that most doctors nowadays just look at, because it turns out good is not just good enough. Yeah. It actually can be quite detrimental.
Yeah. So when you get into this area of medicine, I imagine you get some pushback from your traditional colleagues. Is that correct?
Yeah, so, you do. You do. I've had actually traditional endocrinologists actually said, "What the hell are you doing here?" And after a while, they started seeing the results. They started seeing the reverse diabetes. They started seeing these guys losing weight and increasing testosterone. They saw that their cortisol levels were coming down. They saw that a lot of these issues that we once had, for even thyroid, a lot of times thyroid problems can be caused by inflammation of the thyroid gland because they've been exposed to goitrogens, things that actually inflame the thyroid. Things such as, and they suspect that possibly gluten. Gluten may actually activate or exacerbate thyroid problems. Low iodine levels can exacerbate the thyroid. And many patients, who you take off gluten or you give a little bit of iodine, a lot of times you can reverse thyroid disease. So it's an interesting proposition. I personally would rather, reverse disease than put a Band-Aid on it.
Yeah. Let's talk a little bit about some of the other effects, on cognitive function, on body morphotype, and just in general, some of the benefits of undergoing functional medicine.
Okay. Cognitive function. As people age, they get older, their neurocognitive abilities decline, and that's because of multitude of factors. There is some thought that diabetes or actually elevated sugars may contribute to Alzheimer's disease. In fact, they're thinking of reclassifying Alzheimer's disease as diabetes type 3, which is quite interesting.
Oh, wow. Okay.
Just gives you that insight that maybe having a high sugar is really bad for you. Other things that can do it, obviously, are stress. If your cortisol levels are high, and that can happen because you're undergoing some form of life trauma, whether it be marital issues, financial issues, lack of sleep, all those things will raise your cortisol levels. And if they're too high too long, you can actually destroy the areas in the brain that are responsible for memory processing in the hippocampus. So that's another thing that you have to worry about. Thyroid problems. Your thyroid is off, you're going to affect your memory. If your other hormones, testosterone, is off, your memory is going to be shot. So not to mention the fact also sleep. If you're not getting enough sleep, you're not going to be able to have your memory up and running. Because sleep is not just a simple process of just turning off the lights and just waiting for the. It's actually a regenerative process, and many times throughout the night, you go through these different cycles that actually are processing a lot of the experiences that you've had during the day, and getting rid of the things that you don't need, and storing away the things that you do. And without that running, on all four cylinders, you can impair the memory and also cognitive, apparatus. So that's why, for example, alcohol and sedatives, although people will sleep with them, but they won't have restorative sleep, because it destroys that architecture, that restorative architecture of your sleep that is responsible for helping you process memories as well as cognitive function.
Sure. Sure. Sleep apnea is a major issue. I'm going to switch gears here a little bit on you, Adam. Let's talk about meditation.
Mm.
Tell me about meditation and what part this plays in the functional medicine and your personal experiences. And I know that you're trained, and I'm going to mispronounce it again. Reiki? Did I say it right? Reiki. Okay.
Reiki. It's interesting. Reiki is not really meditation. It's more energy work.
Okay.
But meditation in and of itself is an interesting concept, at least from my perspective. Because if you asked me, I don't know, 5 years ago about meditation, I think you were like a tree-hugging hippie, probably smoking a little bit too much weed. But at the end of the day, I've gone to appreciate it as a great therapeutic tool. In the sense, for example, I guess in my own life, I have a high-pressure job, 4 kids, a wife that was ill. I found that meditation actually helped make me a little bit more even-keeled and maybe able to deal with the things that were being thrown at me during the day. But in my practice, I've also utilized it with my patients. For example, I had a woman who came to my office a couple of weeks ago who her grandkids were flying into town. Her husband was swamped at work. She was dealing with also a sick mother. And under normal circumstances, she'd come to my office. Her blood pressure would be perfectly fine and controlled on the medicines that she was on. But for some reason, when all this was going down, her blood pressure was like 167 over 100. And I said, listen, I can give you more medicine, or we can just try an experiment. And we turned the lights off, and we sat there, and I taught her how to do what we call box breathing or pranayama. Basically, it's a very easy meditation exercise. It's probably a beginner's meditation exercise, where you take a deep breath in. And in this case, I said, take a deep breath in for 4 seconds, hold for 4 seconds. Take a deep breath out for 4 seconds, hold for 4 seconds, and just keep repeating it over and over and over again. Within 10 minutes, I was able to get her blood pressure down to 120 over 70.
Wow.
So there's a huge mind-body connect, and that can be affected by meditation. It could also be affected by your exercise as well, which you didn't bring up. But you can actually bring down your blood pressure about 20 points, 20 millimeters of mercury, just by incorporating moderate, not crazy, marathon running, but moderate exercise. Mm-hmm. What would you rather do? Would you rather take a pill, or would you rather meditate, or would you rather exercise? So if you can incorporate these easy techniques, you can actually even help eliminate some of these medicines or poisons that you're taking.
I know, Adam. I have to laugh. The days are short, and it's really dark and cold. And some days, instead of going out running, I would like to take a pill. But
you'd like to take a pop pill.
but I do have to go out there and go run and do my exercise in the morning.
Because a lot of these medicines also have side effects, and they interact with other things, and it's a trade-off. Because again, all these medicines they're good to a point, but they also cause other problems. So that's why I try to minimize them as much as possible.
Sure. As a certified trainer and Wake Up Warrior, there's a lot of discussion about balance. Maybe you talked about balance in your life and what that kind of constitutes for us and for others.
Okay, well, so the bottom line is that most guys go out and they earn a living. They bust their balls. They're really involved in just bringing home the bacon, bring home the money. And if you look at it, at the end of your life, if that's the only thing you did, it's not really much to show for. I mean, they're not going to put on your tombstone, he worked really hard, or he made a hell of a lot of money. What the legacy is your children, your family, the memories, the values, the passions that you've conveyed over to your family. So one of the big things within Warrior itself is that you need to concentrate on your family. You need to invest in your family. If you don't invest in your relationships, they're going to fall apart. They're going to fall apart. And parcel of all of this is having date night with your children, sending them little notes of appreciation or love, and doing things proactively. So that way you can maintain and even, cultivate that relationship. So that way you can be a 4-dimensional man, not just the guy who makes the money and pays the bills, but really someone who's going to enjoy their life, have something to offer, maybe even transmit some valuable information, some life lessons to the next generation.
Sure. Well, that certainly has been a big plus in my life and my relationship with my wife and my kids, and certainly I've become a better man for following those we call them the core 4 principles, and for doing them, and it's there's no finish line. You just keep on doing it, and you get better. And then some days that you're really good at, and then some days you suck, but you just gotta keep on doing it and going after it.
People are doing, and the bottom line is you're always in competition, really, with yourself, where you were yesterday. You know, it's so often I do CrossFit, and so often it's so easy for you to look at the guy next to you and say, "Oh my God, this guy he's bench pressing, or he's doing thrusters, or he's doing kipping pull-ups much better than I." You know, that's not the point of CrossFit, and that's not the point with life. The point of life is to being better than where you were, yesterday. Are you a better father? Are you a better husband? Are you better in your fitness or your spirituality, whatever it may be? As long as you're moving in the positive direction, then you're winning. And so that's probably the take-home message, at least I've gotten from all this, is that we're all here to just expand, to become better than we were, and just stop comparing yourself, because that's a setup for failure.
Sure, there's not anything. So if our listeners are looking for a proficient, a knowledgeable functional medicine doctor, what kind of questions, or what should they be looking for when they go out? Because it's so hard on the internet. Everyone looks great. Everyone's got a killer website.
Everyone has certifications. Everyone has publications. So you probably would like to go to either the Functional Medicine, American Academy of Functional Medicine website, or the American Academy of Anti-Aging Regenerative Medicine website, and they list down there the physicians that have been trained in those methodologies, and that probably would be beneficial more so to your health in a proactive sense than the traditional route. And that's usually what I do. I tell people who are interested, just go to those websites and start, they have a physician's directory page, and find a physician in your area. Obviously, you want to, test them out, find out by word of mouth or reputation. That always goes a long way. But that's a good start. I typically tell patients, do not go to the head of a department as their doctor just because they're the head of the department. Many times those positions are filled by politics. They're filled because of politics. They're not necessarily the best in their field. They just may have better political connections. Another thing I tell patients to do, which works really well, is if you speak to the emergency room staff in your local hospital and ask them, "Hey, listen, I need a physician for X, Y, or Z. Who would you go to?" Because they're usually the ones who know who's on top of their stuff. They're the ones who know who's going to take better care of you. So those are just some ways how I tell patients, to do their homework, speak to their friends, speak to the local emergency room, go to the resources online, American Academy of Functional Medicine, American Academy of Anti-Aging Regenerative Medicine, and just go with that. And obviously, you have to try and see if you have a good relationship. I mean, going to a doctor is more than just picking someone out of a hat. You have to have a relationship. You have to be able to connect with them. And you need to be honest with them. You shouldn't lie to them. There's certain people you don't lie in your life. Your priest, your rabbi, your doctor, and maybe even your lawyer too. But that's the type of relationship you need to have. You have to be honest. You have to be connected. Because at the end of the day, they're your advocate and they're your guide. And by hiding things or by not sharing things, you're going to be setting yourself up for failure.
Yeah. One of the things I've had challenges that I've had with friends that I've recommended this to is that they go and they ask their primary care physician what they think about it, and obviously the vast majority of the time they get told that this is nonsense or it's unsafe or for whatever things. And I think that you need to expect that you are going to get pushback from your PCP. There's no doubt about it. It's kind of a sad thing because I've got a few friends that come to mind just right off the top of my head that I've recommended this to, and they said, "Well, I went and asked my doctor." And I said, "Well, how tall is your doctor, and how much does he weigh?"
It's true. It's very, very true. I mean, it's funny because the way you just said, that's kind of also why I started this journey. I was saying to myself, all right, listen, if I'm a fat cardiologist, who's going to want to come to see me? If I'm not exercising, if I'm not eating right, who's going to want to see me? You got to practice what you preach. And if your doctor is not practicing what they're preaching and they don't look the role, then maybe it's time for you to choose someone else.
Yeah. We have one. I'm not going to mention a name, but we have one guy who's really famous here in town. And you go in and you go, okay, He's really good at what he does. He's a disease doctor, but he's not going to keep me healthy.
Yeah.
Yeah, if I'm in trouble, he's a great guy to go to.
Well, that's what medicine has always been. It's always been reactionary, always trying to look at the worst possible case scenario and dealing with it. I mean, honestly, I'm a cardiologist by training. And so I deal with not only, prevention, but I also deal with heart transplant. I deal with congestive heart failure, heart attacks, strokes, rhythm disturbances. I mean, I could do it in my sleep. This stuff I could literally do. I've been doing it for so many years now. But what gives me more joy and more pride is the fact that I can help people actually change that trajectory and actually make a difference in their long-term health.
Yeah. So, Adam, as you look out over the horizon, and what do you see are the things coming down the pike in functional medicine that's exciting for people that's coming down the pike? What do you see?
I see a lot of cancer therapies coming down the pike. Doing a lot of immunotherapy, which is actually starting to bleed into the traditional world as well. I think that's a huge new frontier, cancer. And I suspect within our lifetimes, at some point in time, we'll see some major advances in that field. In terms of hormones, I think I'd be saying something horribly wrong if I said that we're done with our expansion in terms of what we know. There's always something more we're going to learn in that. And of course, for me, cardiovascular disease. It's all about taking all these bits and pieces of your metabolism, of your hormonal milieu, of your diet, of your exercise, putting it all together. And I'm sure there's more stuff that's going to come down the pike that's also going to give us, ways of reversing it and preventing. Okay.
So Adam, the old guy is about vices and virtues. Okay. So we've been talking about virtues here, but I always like to find out about vices that my guests have.
Okay.
So, all right. So, what kind of music? Yeah, that's pretty much a typical reaction from my guests.
What type of vices do I have?
Yeah, we got. What kind of music do you listen to?
I have an eclectic mix of music. I listen for everything from pop to classical. I even listen to some international stuff. Juanes I listen to. Those are types of music I'll listen to. What else? What else do you want to know?
Well, okay. So if you are eating something bad, you're basically taking something into the closet and hiding. What is that thing that you're eating that's bad?
It's a burger and fries.
A
burger and fries, and once in a blue moon I'll have that.
Okay, all right. And once in the moon, it's not going to hurt you. Yeah, I went. I went to a meeting at a big cardiology center, and what they had for breakfast was incredible. They had cinnamon buns, and they had McMuffins, custom-made McMuffins on steroids. I was just like, oh my god.
That's the problem. I mean, it's funny because for so many years they've said that fat is a problem and meat is a problem. They're finding out more and more that that's a farce, and it's really not the problem. So having some steak every so often, having bacon or eggs is really not a problem either. So who knows what we're going to find out in a couple of years.
Okay. Do you ever have a cigar?
No, I do not. I do not smoke, and that has to do with my childhood. I had asthma as a child, so cigars. And my dad used to smoke cigars, but would tip off my asthma, so I stay away from that. But I do drink. I'm known to drink. Single malt whiskey is my poison, or tequila. Yes, tequila. I'll have Casa Dragones is my favorite.
Okay. I'm a Scotch drinker. It's my winter drink, and I switch to vodka in the summer as a general rule. Yeah. So pardon me?
No, I was going to ask, single malt or blend?
So usually single malts. I like single malts, and I've been gifted a lot of good stuff. So I'm kind of today I got Glenfiddich. 21-year-old, so that's a nice.
That's a very good bottle. I'm not a PD type of guy. I don't like the Lafroig or Oban. I'm more of a Glenfiddich or Glenmorangie type of guy, or even Macallan.
Okay, so what would someone be surprised to find out about you? What deep, dark secret do you want to confess here on oldguytalks.com?
Deep, dark secrets. I lead a very boring life. I mean, it's not really much of a secret.
Make shit up.
Make shit up. I mean, it's not really a deep, dark secret. My wife died 3 months ago. So I've been dealing with that issue for some time. She's been sick for 5 years. What other deep, dark secrets do I have? I sometimes sing in the shower, but that's a bad visual. What else?
I could have really done without that one, please. Okay, you gotta do something to do the brainwipe. You gotta do something to do brainwipe on that one, dude.
I don't know. I don't have really any deep, dark secrets. I should ask my kids. Maybe they can help me out with this one. I'm a boring guy.
Okay, I don't think you're boring. You got a lot of stuff going on. None of it's boring. So, Adam, I want to thank you. I want to thank you for coming on the program. It was fun. We learned a lot. There was a lot of value to old guys to learn from a young guy like you, punk.
Thank you for calling me young. I love it. Thank you. I should come here more often.
Yeah. Really appreciate you coming on the program. I'm just gonna maybe next week, maybe you want to watch. We're gonna switch gears. We're fully into vices next week. I've got Daniel Marshall coming on the program. He's a world famous maker of humidors. He makes humidors for people like Arnold Schwarzenegger, Will Smith, the King of Morocco, all these great guys. And as my daughter says, a humidor is like a jewelry box for a guy.
Yeah, exactly.
Yeah, cigar. That's right. And so he's on there. He's also famous for making a 24 for a cigar. His custom line cigars that are wrapped in 24 karat Italian leaf gold. Yeah, so that's
an expensive vice.
That's an expensive cigar. That's an expensive cigar. But he'll be on our program next week. If you have not already opted in, do so now. Don't wait. Don't hesitate. Don't procrastinate. When you do, you're going to find out 3 ways to get laid more often without begging. Because begging is not good. Begging is, you might as well just turn in your man card right now if that's what you're gonna do. But the old guy's got 3 ways that he'll tell you, surefire ways to get laid. And if that doesn't work, you can PM me, and I'll be able to help you further with some personal intervention. So, folks, that's all we got. I want to thank again Dr. Adam Splaver from Florida, and renowned cardiologist and functional medicine expert. And if they wanted to find you, where do they find you?
I'm found at my office in Hollywood, 954-980-0361. Nano Health Associates, nanohealthassociates.com.
Okay, I'll put a link on that. And that's Hollywood, Florida.
Correct.
We think we West Coast people think Hollywood, California. But California. So we're talking about Hollywood, Florida. So, folks, this is it. And have a great day. And remember, it's all about creating a kick-ass life. That's right. It's about creating a kick-ass life. Good night.
Opt in and encourage other old guy assholes like you to opt in also.